The resolution is adopted. Without objection, a motion to reconsider is laid upon the table. For what purpose does the gentleman from Georgia seek recognition?
Mr. Speaker, I ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and include extraneous material on H.R. 6079.
Without objection, so ordered. And for what purpose is the gentleman from Georgia standing?
Mr. Speaker, I ask unanimous consent that when the House adjourned today, it adjourn to meet at 9 a.m. tomorrow.
Without objection, so ordered. The Chair lays before the House an enrolled bill.
Senate 2061, an act to provide for an exchange of land between the Department of Homeland Security and the South Carolina State Ports Authority.
For what purpose does the gentleman from North Carolina seek recognition?
Mr. Speaker, I ask unanimous consent to be considered as the first sponsor of H.R. 2181, a bill to authorize National Mall Liberty Fund, D.C., to establish a memorial on federal land in the District of Columbia to honor free persons and slaves who fought for independence, liberty, and justice for all during the American Revolution. The bill was authored and introduced by our friend and colleague, the late Donald Payne, Sr. from the state of New Jersey.
Without objection, so ordered.
Thank you.
The Chair will entertain requests for 1-minute speeches. For what purpose does the gentleman from Minnesota seek recognition? Without objection.
Mr. Speaker, my home state of Minnesota has a remarkable legacy when it comes to charter school education. By launching the first charter schools in the country, along with leading the way in public education reform nationwide, we have been able to serve our students and community for the past 20 years in a better way. In celebrating 2 decades now of achievement, let's ensure that this tradition continues by looking for further ways to improve these schools, making them effective for all American students. I was pleased, Mr. Speaker, that my amendment to the Empowering Parents Through Quality Charter School Act not only enhances teaching methods in schools, but also breaks down the barriers to make charter schools more accessible for the thousands of students that are now waitlisted across the country. Young people should have the opportunity for a good education regardless of their zip code. Mr. Speaker, I want to recognize the recent anniversary for charter schools and encourage their support in the years to come, and I yield back.
For what purpose does the gentlelady from Ohio seek recognition?
Consent to address the House for 1 minute.
Without objection.
Mr. Speaker, the draft Farm Bill, unfortunately, contains serious damage to the Supplemental Nutrition Program, the foundational food lifeline for millions of Americans. What a shame. When unemployment levels remain too high, with the cost of living rising, with food prices going up, that affect so many of our senior citizens and millions of Americans who live at the edge, surely this Congress can do better. Wall Street speculators and bankers got to keep all their bonuses, and the Republican majority can't seem to find their way to ask the richest to pay something to help our republic close the gap. Millionaires and billionaires, couldn't they forego some of their ill-gotten treasure, especially the speculators who led this republic to the edge? So what do the Republicans do? Literally take food out of the mouths of children, seniors, the unemployed, the disabled, $16 billion worth. Citizens who live at the edge of poverty receive $1.50 per meal in benefits. The Farm Bill thus far takes food off the table of up to 3 million Americans and asks nothing of millionaires and billionaires. What a shame. I urge my colleagues to oppose the cuts to SNAP. I yield back my remaining time.
Are there any other requests for 1-minute speeches? Okay. For what purpose does the gentleman from New York seek recognition?
Speaker, ask unanimous consent to address the House for 1 minute and to revise consent.
Without objection.
Thank you, Mr. Speaker. I rise today to oppose the deep cuts proposed to the Supplemental Nutrition Assistance Program.
The SNAP program provides low-income families, our disabled, and our elderly essential access to healthy foods. We should not ask our most vulnerable citizens to go hungry. To balance the federal budget, a cut of $16 billion in SNAP benefits will not achieve that balanced budget. So SNAP benefits not only provide needed nutritional support to recipients, they support local economies and our farm operations by boosting sales of fresh fruit and vegetables at farmers markets and local grocery stores. Our nation's farmers and ranchers produce high-quality, abundant foods in a system that is the envy of the world. There is no reason for anyone to go hungry in the United States. Let's produce a food and farm bill that each day gives farmers a fair deal and ensures all of our citizens nutritious meals. With that, Mr. Speaker, I yield back.
For what purpose the gentleman from New York seek recognition? Without objection.
Mr. Speaker, in my hometown of Buffalo, New York, nearly half of the Bills games are blacked out last season because, despite an average game attendance of 67,000, the games were not sellouts because Ralph Wilson Stadium is one of the largest in the league. Last week, we learned that the NFL owners passed a resolution allowing teams to decide to broadcast games locally when more than 85% of seats are filled. This is a change to current policy, which requires a stadium to be sold out. If teams embrace this new policy, it will be a game changer for football fans in Buffalo and across the nation. This change would not have been possible without the hard work and dedication of loyal sports fans, including Sports Fans Coalition, the Buffalo Fan Coalition or Alliance, and the Bills Mafia. I urge the NFL owners to opt into this policy and the Federal Communications Commission to consider a similar policy change. Fans support their local stadiums with their tax dollars. It's time for teams to give back something in return for that commitment that they have made. I yield back the balance of my time.
Are there further requests for 1-minute speeches? If not, the chair lays before the House the following message.
To the Congress of the United States, pursuant to the International Emergency Economic Powers Act, 50 U.S.C. 1701, IEEPA, I hereby report that I have issued an executive order, the order that modifies the scope of the national emergency declared in Executive Order 13047 of May 20, 1997, as modified in scope in Executive Order 13448 of October 18, 2007, and relied upon for additional steps taken in Executive Order 13310 of July 28, 2003, Executive Order 13448 of October 18, 2007, and Executive Order 13464 of April 30, 2008, and takes additional steps with respect to the national emergency. In Executive Order 13047, the President found that the government of Burma committed large-scale repression of the democratic opposition in Burma after September 30, 1996, and further determined that the actions and policies of the government of Burma constitute an unusual and extraordinary threat to the national security and foreign policy of the United States. To address the threat and to implement Section 570 of the Foreign Operations, Export Financing and Related Appropriations Act 1997, Public Law 104-208, the President in Executive Order 13047 prohibited new investment in Burma. On July 28, 2003, the President issued Executive Order 13310, which contained prohibitions implementing certain provisions of the Burmese Freedom and Democracy Act of 2003, Public Law 108-61, and blocked the property and interest in property of persons listed in the annex to Executive Order 13310 or determined by the Secretary of the Treasury in consultation with the Secretary of the State to meet designation criteria specified in Executive Order 13310. While the government of Burma has made progress towards political reform in a number of areas, including by releasing hundreds of political prisoners, pursuing ceasefire talks with several armed ethnic groups, and pursuing dialogue with a democratic opposition, this reform is fragile. I support this reform in Burma and the building of a democratic political process that will allow all of the people of Burma to be represented. However, I have found that the continued detention of political prisoners, efforts to undermine or obstruct the political reform process, efforts to undermine or obstruct the peace process with ethnic minorities, military trade with North Korea, and human rights abuses in Burma, particularly in ethnic areas and outside the government of Burma, constitute an unusual and extraordinary threat to the national security and foreign policy of the United States. To address this situation, the order imposes additional measures with respect to Burma. The order provides criteria for designations of persons determined by the Secretary of the State in consultation with or at the recommendation of the Secretary of State to have engaged in acts that directly or indirectly threaten the peace, security, or stability of Burma, such as actions that have the purpose or effect of undermining or obstructing the political reform process or the peace process with ethnic minorities in Burma. To be responsible for or complicit in or responsible for ordering, controlling, or otherwise directing or to have participated in the commission of human rights abuses in Burma, to have directly or indirectly imported, exported, re-exported, sold or supplied arms or related material from North Korea or the government of North Korea to Burma or the government of Burma, to be a senior official of an entity that has engaged in the acts described above, to have materially assisted, sponsored, or provided financial material or technological support for, or goods or services to or in support of the acts described above, or any person whose property and interest in property are blocked pursuant to the order, or to be owned or controlled by, or to have acted or purported to act for or on behalf of, directly or indirectly, any person whose property and interest in property are blocked pursuant to the order. I have delegated to the Secretary of the Treasury the authority, in consultation with the Secretary of State, to take such actions, including the promulgation of rules and regulations, and to employ all powers granted to the President by IEEPA as may be necessary to carry out the purposes of the order. All agencies of the United States government are directed to take all appropriate measures within their authority to carry out the provisions of the order. I am enclosing a copy of the executive order I have issued, signed Barack Obama, the White House, July 11, 2012.
Refer to the Committee on Foreign Affairs and ordered printed. Under the Speaker's announced policy of January 5, 2011, the gentleman from New York, Mr. Tonko, is recognized for 60 minutes as the designee of the Minority Leader.
Thank you, Mr. Speaker. And this evening we are going to address for the coming hour with a couple of our colleagues the issues of affordable health care and the fact that we see a pattern here that's established by the House that seems to walk away from the needs of a middle class, a working class in this society. Our country depends upon a thriving middle class, one that is given the respect and the dignity it so much deserves. And with the attacks on Social Security, with its 76-year-old history, and the efforts to privatize Social Security, we understand that that would put at risk a number of people. Not a single cent of Social Security was lost to its recipients during the very painful recession. And likewise, in the mid-60s, we saw the emerging of Medicare, which allowed for, again, the dignity factor to be presented and found in the midst of our senior households, where at that point in time, prior to Medicare, those who would retire would anticipate a decline in their income, in their economic security, simply because of the impact that their health care costs would have on their retirement years. Since then, not only have we seen a stronger sense of security and stability in those senior households, but we have seen a strengthening of the response for the health care needs of our seniors because of the stability that Medicare produced and the quality of the care that has been part and parcel to the Medicare history. And so now, in its infancy, the Affordable Care Act is under threats with a repeal measure that was just taken on this House floor to undo the progress that was achieved for, again, America's health care consumers, and it is a troubling notion at best. So this hour of discussion will be dedicated to the concerns that we have for the economic ripple effects that befall the middle class, that needs to be a thriving middle class, and the impact of several of these attacks that seem to undermine the very foundations upon which security is provided to America's great populations. So we're concerned. We're concerned about that repeal and what it means, what is removed from the equation of success that was brought about a couple of years ago as we worked in a bipartisan, bicameral way with the White House to make certain that a growing need out there that found this country as the only industrialized nation to not have a universal health care program to be at risk again because of the efforts to repeal. So we're joined by my colleague from California, Representative John Garamendi. And John, you witnessed this vote just now to repeal health care. And the Affordable Care Act was providing hope and opportunity and promise to all generations in this American mosaic. And it is a tragic moment.
Well, Mr. Tonko, thank you so very much. And thank you for beginning this discussion by going back into the history of the United States, back to the development of Social Security and the extraordinary benefit that that has brought to not only seniors but to their children, to families, knowing that when retirement age approached 65, there would be a foundation for whatever retirement program a person would have. And also pointing out that for years now, and certainly in the recent decade, our Republican colleagues have called for the privatization of Social Security. Now, if you trust Wall Street, then I guess it's a good idea, but if we had any lesson, we should have had the lesson of 2008 and 2009, when Wall Street turned its back on the American public and simply ripped us off to a fairly well and nearly collapsed the world economy. Were it not for the efforts of the Obama administration and, frankly, this Congress, it may very well have happened. And then you pointed out the Medicare coming along in 64, 65, and the way in which that has protected seniors. I remember as a young child, I think I was probably 7 or 8, my dad took me down to the county hospital to visit one of our neighbor ranchers. I got to tell you, it was horrible. That was the only care available for a senior who had no money. And then Medicare came along, and 60% of America's seniors were in poverty prior to Medicare. Now, with Social Security and Medicare, it's somewhere around 10, 15%. An enormous boost, yet twice this House has voted to terminate Medicare. Not the Democrats. Right. Our Republican colleagues twice have voted to terminate Medicare so that every American less than 55 years of age would not receive Medicare. They'd be given a voucher and told to go fight as best they could in the private insurance market. And then today, another major effort by the Democrats to provide health care for all Americans and health insurance policy that you knew was there, that you could count on, that would be affordable. The 31st time today a full repeal or a partial repeal was taken up and passed by our Republican colleagues. So what's an American to do? What does it mean to Americans? Let's spend some time talking about what this means to Americans. If you didn't have Medicare, if you didn't have the Affordable Health Care Act, what would it mean? I'm going to start, if I might, or would you like to start?
Absolutely. We, I know, are joined by some of our colleagues, but if you want to go through your chart.
Well, let me just take up the Patient's Bill of Rights very, very quickly. I was the insurance commissioner in California for 8 years, and the insurance industry puts people behind profits, profits before people, and they're concerned about making sure that they have a healthy group of customers. They don't want sick people. Sick people cost money. So over the years, they've developed a whole set of discriminatory practices to exclude from coverage people that they don't want to take care of because they might be expensive. So in the Affordable Health Care Act, there is what we call the Patient's Bill of Rights that forces the insurance companies to end insurance discrimination. And here's just some of them. Children with pre-existing conditions. An example, my chief of staff. His son was covered by insurance the day he was born. The second day of his life, they discovered that kid had very serious renal failure, kidney failure. Bam, the insurance was over. That family was off their insurance policy, gone, done. No longer. We're talking about, I think, 14 million American children that are going to get covered regardless of what their health circumstances might be. Young adults. This one's close to home. I've got 6 children. Every one of them have passed through that age of 21 when they were no longer on our insurance policy. Most recently, my daughter. 21 years of age, covered by an insurance company for 21 years and 9 months. Day of her 21st birthday, off the insurance policy. We're now talking about every young American 21 to 26 stays on their parents' health policy. She also happens to be a woman. Women are discriminated against in the insurance because they have a pre-existing condition. They could get pregnant. That's expensive. We don't want to cover them, say the insurance companies. No, no. Under the Patient's Bill of Rights, the discrimination against every woman in America on their insurance policy is over. Apparently, our Republican colleagues don't care about these very, very important efforts to end insurance discrimination. We can go on here. Seniors. Who among us doesn't have a pre-existing condition? High blood pressure. No. Juvenile diabetics. Type 2 diabetics. Try to get insurance without the Affordable Health Care Act. You're out of luck. You won't get insurance. So the Patient's Bill of Rights, should today's action become law, is repealed. And along with it, the protections that 365 million Americans presently have. No more insurance discrimination. The ability to get insurance is guaranteed. No more discrimination. Yeah, I'm a little passionate about this one because I watched this. I watched this as insurance commissioner. I fought the insurance companies day in and day out as they denied coverage, as they refused to provide the coverage, as they told people they couldn't get care. But the law is in place now. The law is in place, and it's going to stay in place despite the vote today.
And interestingly, Representative Garamendi, we've been reminded, I think, by the general public that, look, the legislature, the legislative body here, Congress, took up the bill, they passed it, went over to the President, he signed it. The highest court in the land, a conservative-leaning court, reviewed it, assumed, made their decision, and rendered a decision that said it met with constitutionality. People are saying, go forward, move on, get to the issues that now have got to be resolved, and that is the economy, creating the jobs, producing the post-recession responsiveness that people so much require and deserve. And that's where they're at. We've been joined by Representative Eleanor Holmes Norton, who has joined us. Representative, thank you for joining us in the special order.
Well, I want to thank you, Representative Tonko, and my other good colleague, Representative Garamendi, for leading this special hour and for offering the perspective that you've begun this hour with, something that our fathers and grandfathers are responsible for, the greatest generation. We all, and now has been embraced by the American people, and as proud Democrats, we're very, very proud of these very important reforms. I wanted to to come to the floor as well to offer some real-life, real-time evidence as people try to judge what they've heard on the floor today, what they heard on the floor yesterday about the health care bill. We teach our children fair play. You know, you win some, you lose some. When you lose, then you've lost that one. You try again another time. What they've seen in the House this year and last year is the Republicans tried to repeal financial reform. They lost that. It's as if the law of the land weren't the law of the land. Now they're trying to repeal health care reform, even when the Supreme Court announces the law of the land. They've come to the point where they do not recognize the law of the land as announced by passage in the Senate and the House, signature of the President, and in the case of the health care reform bill, the imprimatur, which is the last word of the Supreme Court. But as I heard the debate, I was concerned that the American people would be concerned in the face of this economy about what they hear our colleagues on the other side say that the health care bill will do to the economy, an attempt to essentially frighten people, especially yesterday when the Republicans came forward with a usual set of horribles. This is after the bill is passed now, and where we ought to be thinking of the best ways to implement it. But none of those horribles about what was going to happen to the health care bill was data-based. We ought to ask ourselves, why would not the Republicans use the one existing experience that we have, the 6-year experience of the Massachusetts health care law, which is the very model for the health care law we passed. And that, of course, was a law that was engineered by their own candidate for president. Well, I had the occasion to look at the experience under that bill because, as you may know, our colleagues had hearings all around the House yesterday on health care reform as a prelude to the debate that was on the floor. And I was in the Oversight and Government Reform Committee, and the hearing was on the impact on jobs. Now, if you want to scare the American people, tell them that the bill we've just passed is going to add to the problems in their jobs. One of the witnesses was a state senator from Massachusetts who is also, he's been state senator for 2 years. He was not in the Senate when Governor Romney's bill was passed. He is a CEO of Cape Air. That's a 1,000-employee company. It's a hard business because it's the airline business. It's a regional airline. And he had some real-time experience for us. And I think it's important just to say a few words about what Massachusetts Senator Wolf, who for 6 years served on the Federal Reserve Board's Advisory Council of New England, who was board chair of one of the largest chambers of commerce in Massachusetts and is a trustee of the largest mutual bank in the Cape and Islands region. This is a real small businessman of the kind we have in mind when we talk about small business. This is what he reported, that the premiums are today under the Massachusetts bill, which is our bill is patterned after, is roughly 3% of his company's gross income. And to quote him, health care reform has not stifled business. Since the passage of the health care reform bill, the very bill that is the predecessor for our health care bill, This company has added 15% more Massachusetts-based jobs. He talks about premiums. Importantly, he said that just before the passage of the Massachusetts law, the premiums were going up 15 to 20%. They are down now to going up 5%. And he said last year he was able to negotiate a 5% decrease. My friends, part of this, a great part of this, has to do with the large pool that, of course, Massachusetts citizens are in now. And when you see these reductions, the state spending for health care reform programs last year represented a 1.4% of the state budget. Two-thirds of their residents support the health care reform. It was an extraordinary piece of testimony from a businessman who had no reason to come forward. He's not a politician. Yes, he's in the state Senate, but he had the credibility of being in the Senate and being a quintessential businessman. I want to suggest to my colleagues that there's a reason why our colleagues do not point to the only real experience that could tell us anything about what is going to happen with this bill. And that is because they are driven not by data, but by some ideology that is not understandable. But once you get it in your head that if you're against the bill, even when it's passed, you've got to do all you can to kill it. If it's health care reform, you kill health care reform. If it's financial reform, even after the worst recession since the Great Depression, then you try to kill that. I think that in hearing what has happened in Massachusetts, that you would think Mitt Romney would be shouting from the hilltops about. When you see what's happened in Massachusetts, that what the Republicans, what we ourselves should be doing, is studying in depth the experience of Massachusetts, seeing what their mistakes were, looking at their successes, instead of throwing horribles out there based on no data and based on nothing. I thank you for coming forward to start a discussion that helps give the American people some broader sense of what this struggle is about and helps them to understand that when they hear the word repeal, it is not what it means. In order to repeal, you have to get both houses and the signature of the president. People should be alerted that this bill is here to stay. It is almost impossible, it will be almost impossible unless there is a Herculean change in the House, the Senate, and the presidency to change the Congress in the direction of those who oppose the bill. Absent that, every member of this House who believes in law and order, who believes in the rule of law, has an obligation to sit down together to make this law work and not try to undermine it. To the extent that you undermine it, you are now undermining the health care of the citizens of the United States of America. And I yield to my friend, Mr. Tonko.
Thank you, Representative Holmes Norton. And, you know, you talk about the struggle and the move to repeal, and it obviously didn't place consumers first and foremost in that thought process. It was probably listening to those deep pockets of interest that did not want to be pulled to the table to provide better outcomes for our consumers. Look at the benefits of the health care law for our seniors. 5.1 million seniors receiving savings on their prescription drugs. Actually, I've seen this number as high as 5.3 million and probably climbing in the short order of time. What an important, significant savings. I hear it all the time from seniors in my district who are always reaching into their pockets after that donut hole is hit, and they get the benefit for a while until they hit a certain threshold, as we all know, Many, in the short order of months, are digging into their own pockets. And these are medications that are required to stay well and in some cases in many cases to stay alive. 32.5 million seniors receiving free preventative services, health care screenings, the annual checkup, flu shots, items that are brought to their benefit in order to, again, underscore the value added of wellness. Strengthening consumer protections for seniors in the Part D program, something I heard a lot of favorable review about. And 85% of Medicare Advantage plans revenues going towards senior medical care rather than profits for the insurance industry. So these are big changes. These are changes that were welcomed by the senior community. I can tell you, if you close that donut hole by the year 2020, as the Affordable Care Act is to do, you're providing a major benefit for seniors with the advancement of pharmaceuticals that speak to all sorts of illnesses. This is a wonderful opportunity for them to understand the attachment that is essential. I heard far too many people adjusting their dosages of medications to balance their family budget. That is not the best outcome for health care. This advances sound decision-making, efficiencies, the best use, the wisest use of resources, and again, speaking to the dignity factor of our country's senior citizens. Representative Marcy Kaptur from Ohio, a great representative, a strong voice for consumers in this House. Thank you for joining Representative Garamendi and myself. It's great to have you here, and I know that you're hearing a lot in the state of Ohio.
I want to thank you, Congressman Tonko, for your leadership and on so many issues that relate to the well-being of the American people and our economy. Health care is 1/6 of the leg of the stool that holds up the republic. It is a major industry. When you look at all of our medical hospitals, all of our schools, the nursing profession, dentistry, and you take it all together, it is a massive employer across our country. And Congressman Garamendi, I mean, coming from California, your experience is so vast in terms of your leadership at the state level there, and now here as a member of Congress. So I'm very proud to stand with colleagues from New York and California, coastal powerhouses from the state of Ohio, right in the middle of the country there. And I wanted to add to your discussions this evening some real-life stories that illustrate what you've been talking about tonight. Here's a story from Toledo, Ohio, a real story of a couple that was forced to drop their health coverage after the wife got sick, and their health insurance premiums jumped from $800 a month in 2007 to $1,200 a month in 2008. How many families across our country, when somebody gets sick, the premium goes up? This bill is wonderful because it doesn't allow that to happen. For this family, the cost in 2009 would have risen to $1,600 a month with a $2,500 deductible. And so what did the couple do? They dropped their insurance. They couldn't afford the insurance, even though the wife was sick. But because of the law that we passed, the wife received coverage through a high-risk insurance pool that was set up within our state following the passage of the law, and they're paying $400 a month, less than they paid before, half of what they paid before, and they have a $1,500 deductible. Literally, the new insurance coverage saves them $15,000 a year, which for them was, I mean, unaffordable. That's why they dropped their insurance. But just that family alone tells us how important this bill is, this act is, and think of how many cases across this country have similarities to theirs. From Marblehead, Ohio, which is very central to the district that I'm privileged to represent, a small business owner, a woman, was diagnosed with lupus, and she was turned down by multiple insurance companies because she had a pre-existing condition. But because of this act and the high-risk insurance pool in Ohio, she was able to obtain a plan for $315 a month with a $2,500 deductible. That was her choice. But she has obtained insurance, though she has a pre-existing condition. How many Americans have you said have pre-existing conditions. This allows them to continue to pay, not be canceled, so they're contributing to the pool, the insurance pool, and they're able to take care of themselves. And finally, the third example I wish to place on the table is a senior citizen couple that faced a $3,000 to $4,000 bill in extra prescription drug costs after the husband developed a staph infection. How many families do we know have relatives that develop staph infections? And it required them to spend a lot more money in 2009 and 2010 on prescription drugs. Thankfully, the husband's health has improved, and they've saved money thanks to the donut hole provisions you talked about that took effect in 2010. So they didn't have to pay that extra money for the prescription drugs necessary that you have to take when you get an infection. You have to take those for a very long time, and they're very expensive. And the wife said of their situation, for seniors like Paul and me, living on limited income through Social Security, these costs were not a joke. And because of the Affordable Care Act, no senior ever will have to go through what Paul and I spent that year doing. And by the end of this decade, that donut hole will be completely closed at the rate of $500 a year. $500 a year to a senior citizen is a mountain of money. $50 is a lot of money because they're on limited incomes. Most people depend on Social Security to hold their lives together. So to get bills of $500 or $5,000, it's an impossibility. All you have to do, I challenge every American who's listening to my words tonight, when you go to, and every young person who has a conscience, go to the supermarket and look for some of the people who are staring at the vegetables or raspberries or fish and they can't afford to buy it. Maybe you could slip them a couple bucks in the supermarket. Nobody even know about it. I've done that so many times. And they can buy something they want that they can't afford to buy. So when you're a senior citizen, limited income is a real fact of everyday life. So for all of the millions and millions of Americans, Congressman Tonko, that you talked about, this is being lived life by life, family by family in the state of Ohio. And I'm very pleased to join both of you and to thank the President of the United States for having the guts to stick with his convictions, and our Speaker then, Nancy Pelosi, for fighting so hard for every vote in this House and really helping to lift all of America to a different plane for the future. And the last thing I will say is I come from a small business family, and our father was one of those people that had to sell his business because he got sick and he had to get health insurance for his family, so he went to work for an automotive company. And I remember how ill he became and what a horrible choice that was for him back then. Half the uninsured in this country are small businesses. The law says if you have 50 or under, you don't have to provide insurance, but if you're interested, those exchanges will be there for you, and there will also be plans that your employees can buy into if they want to. Wow. Do I wish that had existed in the 1950s when we were growing up as young children and our dad could have had that plan so he wouldn't have had to sell his business. What a difference that would have made in our family. So I think, and that story is repeated by the tens of millions across this country. Half of those who could potentially benefit are small business owners and their workers. So thank you for doing this special order tonight as we speak on behalf of all of the American people.
Thank you, Representative Kaptur, and please feel free to share more information with us. But, you know, the anecdotal evidence that you provide from your region alone, you know, speaks to the empowerment that is part of this transition, this progressive policy. And to now attempt to repeal, just as you've given people the sense of hope that there will be a doable outcome, that they won't have to cut medication in half so that they could have enough money to do all the other items that are required of them, to pay utility bills or to afford to eat for that given month. The fact that they would cut their medication in half is not a sound thing. They're spending money and it's probably ineffective. And so tethering people to a system that is sound and secure, You know, when people say, well, I don't want to pay for someone's insurance, I don't want to pay for this health care program, you're paying today through premiums and through taxes. You're paying for the worst sort of outcome by putting people into emergency rooms and having them visit with a different doctor each time they visit, and not having the stability and the standardized outcome that is predictable and effective and efficient. These are the dynamics that are driven by the soundness of a policy like this that, yes, will take investment, but will get far greater bang for the buck than what we're getting today with a haphazard sort of response that does not provide continuity or direction or standardization or predictability and certainty. We will be far better off, and a much more compassionate response is rendered. So from a taxpayer perspective, from a consumer perspective, it's a far greater, stronger, more intelligent outcome. And it speaks to, I think, the core fabric of this wonderful country, that we do truly care. And this is a way to show it and still be economically sounder in our attempts. So thank you for sharing the anecdotal evidence. Representative Garamendi, you and I have done a number of these special orders on this floor, on this House floor, and I find it fascinating to see what the response is out there from the public, who always call to engage and get more information. And so the fact that we can provide more information on what is included in the Affordable Care Act, I think, is a good opportunity here. And I know you always have a lot to say and a lot to share, and your walk in your professional life as insurance commissioner, it was an important bit of strength for all of us in the caucus.
Well, Mr. Tonko and our colleague Marcy Kaptur reminded me of personal things. My sister-in-law was a juvenile diabetic. And I think, what would her circumstances be if she had had this law when she was alive? The last 20 years of her life were a struggle. The company she worked for folded and her health insurance was lost. And she spent the last 20 years of her life struggling financially, medically, and really unable to get the kind of continuity of care necessary. She got a lot of help from her family, but even so, it was a struggle. Under the law today, she would have been able to get insurance. And in 2014 in California, or actually next year in California, there will be an insurance exchange. So even though she spent those last 20 years as an independent contractor selling various things over those years, she could enter into a large pool, that is the exchange, where she would have the same opportunity to buy a low-cost policy as though she were in Ford Motor Company with hundreds of thousands of employees. Our Republican colleagues would abolish the exchanges. And I just think about what could have been. There was no exchange, and she wasn't able to get that insurance. But had she lived and had other men and women with diabetes or serious heart issues or other kinds of problems, medical problems, they could get insurance in the exchange and be part of a large pool. And simultaneously, if they didn't have the income, they would be able to get a subsidy. If their income was less than the poverty level, that insurance would be free through the Medicaid program. And if they were above the poverty level, it would be subsidized so that it would be affordable. And I guess this is really about compassion. This is about our very moral sense of who we are as Americans. Do we have compassion, and do we care for our fellow citizens? On today's floor, I heard the most astounding arguments based upon falsehoods, just flat-out falsehoods. I heard the speaker here say that the Affordable Care Act cost employment. But since the Affordable Care Act has been in place for the last 2 years, private sector employment has grown every single month. Now, there may have been some company that decided not to employ somebody, or maybe they went out of business for any number of reasons. But private sector employment has grown every single month for the last 28 months. So taken as a whole, the Affordable Health Care Act didn't retard employment. It didn't cause the number of private sector employees to decline. In fact, they've grown. And I also heard the very same person with the very same argument say that it's driven up health care costs. Well, excuse me. Take a look at the statistics, the health care statistics. We've actually seen in the last 2 years since the Affordable Health Care Act went into effect a significant decline in the rate of inflation for health care. In fact, the rate of inflation for health care in the last 2 years, 2010 and 2011, was the lowest rate of growth in every year except one in the last 50 years. It was 3.9%. Those are not my statistics. They're not pulled out of the air. Those are government statistics about health care inflation. 3.9%, which was the lowest rate of inflation in general health care in the last 50 years, except only one other year. How about the cost of premiums? Before I get there, the average health care spending in 2000 to 2009 was 6.8% per year. That's the annual growth, 6.8% per year. In 2010 and 2011, as I just said, it was 3.9%, nearly 50% less. Let's get our facts right. Put aside the rhetoric and deal with the facts. If you're going to come down here as Speaker or anybody else, use facts in your argument. Don't just throw out a number. Mr. Speaker, if you'd like to debate it on the floor with me, come on down. Seniors paying more? No, I don't believe so. No, they don't pay more. Medicare Advantage enrollees, the cost of premiums for Medicare Advantage was 16% less in 2012 than in 2010. The Affordable Health Care Act, was it responsible for that? Partly, yes, because the Affordable Health Care Act took $150 billion, $15 billion a year, away from the insurance companies and plowed it back into Medicare benefits, the drug benefit that you were talking about, free medical services, preventative services. The result was a 16% reduction overall average across the United States for Medicare Advantage. Aetna, a rather large insurance company. Oh, by the way, these are statistics from Mercer, one of the healthcare consulting companies. I think I'll let it go at that. There are more statistics about this, but Mr. Speaker and my colleagues on the Republican side, if you want to come down and debate the issue of health care inflation, then you better come down here with real facts. Don't come down here with a lot of just talk. But health care inflation has gone down since the Affordable Health Care Act has been put in place. Mr. Tonko, why don't you pick it up from here? Maybe I'll have a challenge on the floor from the Speaker. We'll see.
There you go. Representative Garamendi speaks of the Medicare Advantage programs. And obviously, you know, that they came about because there were those who suggested they could do it cheaper. Give us a special model out there and launch it as a pilot, and we'll show you how we can do these special programmings and give us a return. Well, after reviewing now what is a history of all of that, it was deemed that there were overpayments of anywhere from 12 to 14%. And so the dollars were slid over to programs like filling the donut hole and providing for screenings for our seniors, not taking it away from a category of healthcare consumers, in this case an age demographic of seniors, but taking those savings as we sweep those savings and reinvesting them in a way that provides balance, more sensitivity for the consumer, rather than having record profits developed for an industry. To me, that was progressive policy. And for people to then take those savings and use them in their own budget presentations for other purposes was disingenuous. Now, when you talk about the efforts today of the Affordable Care Act to include an exchange, what I think is oftentimes lost, Representative Garamendi, is that people see this as some sort of public exchange that's going to be run by the government, when in fact we set up an exchange and the private sector sources come to the table if they're willing to abide by the rules, if they're going to govern themselves by the parameters that have been established in the legislation, they can then offer services through the exchange. So it's a private sector solution, but with new caveats of parameters that are established so as to provide benefit for the consumer. And when you think of it, if there are firms that hire 10 people and one of those 10 becomes catastrophically ill, the actuarial impact of that one individual circumstance can drive premiums up for that small business in very high order. That kind of impact is unacceptable for the small business community that today pays some 18% more for their insurance and oftentimes get weaker coverage. With the benefits of an exchange that is private sector driven, you now have the opportunities that people can have that actuarial measurement made in a pool of perhaps millions, so that the unsteady and unpredictable kind of outcome for small business is now rendered more efficient and more sensitive by shaving the peaks that may occur in a universe as small as 10 people. So there is a science to this. There is thoughtfulness that has been pumped into the discussion, and by inserting that thoughtfulness, we have come up with reforms that really speak to a wiser use of this country's health care dollars. To then move to repeal before a number of these programs are even implemented, it was a folding in of progress over the course of several years now that was initiated with the passage a couple of years ago that needed time to work. And for people to just play politics with the lives of individuals, with the health care quality of individuals, is regrettable. And for us then to be asked to visit for the 31st time a repeal exercise in some 19 consecutive months, we used this week of session in Congress to debate for hours, to message for hours, to come to the floor for votes. These were session days that were used up for a repeat of an exercise that time and time and time again has been conducted just to politically posture. When in fact the American public is saying, look, you voted on this. Look, the President signed it into law. Look, the Supreme Court, the highest court in the land, conservative-leaning court, has ruled constitutionality. They want us to move forward with job creation, responding to the cures this economy needs. We started with a terrible pit of a recession. 8.2 million jobs lost. 800,000 jobs being lost per month as this administration started. And ironically, when I started my service in the House of Representatives. We are in a dark, deep hole. And to come out of that with 29 consecutive months of private sector job growth, to come out of that with over 4 million jobs created in the private sector, and to go forward with an effort to reform our health care system in a way that extends greater opportunity, beacons of hope to families, individuals, those catastrophically ill, those denied because of pre-existing conditions, pharmaceuticals, unaffordable for many seniors. To have all of that turned around and have all of this progress of the comeback trail from the recessionary period that was far too long and far too deep and far too painful than anyone ever forecasted, to strike that kind of progress and then have it met with 31 consecutive efforts to repeal the situation is regrettable. It's regrettable. Representative Garamendi, you've been here for those 31 efforts. Has anything changed? It's the same old, same old. that's being expressed out there that does not, I think, meet with the concerns of individuals out there from coast to coast.
Well, you're absolutely correct. We really need to get to jobs. I notice some of our Republican colleagues are here, and they'll be taking the next hour, and I suspect they're going to pick up something that was said over and over again over the last 2 days, and I just want to put on the table some facts about what is really going on here. I heard speakers come to the floor, including the Speaker of the House, saying that the Affordable Health Care Act was the largest middle-class tax increase ever. Well, I'm sorry. However, the Washington Post fact-checker said the health care law will provide more tax relief than tax burden for middle-class families. A report from the Nonpartisan Congressional Budget Office shows that an estimated 4 million individuals will likely pay the penalty because they're not going to buy insurance. Okay? That's about 1.2% of the total population. They also estimated that 16 million Americans, that's 4 times more, will receive tax credits or subsidies to help them pay for insurance coverage through the new exchanges. Now, that's 5% of the population. The CBO estimates that the government will provide $630 billion in tax credits and subsidies for insurance over the next 11 years, and only $54 billion in penalties, taxes, or tax increases on the middle class. So the fact of the matter is the middle class is going to get an enormous tax benefit as a result of this. Their taxes, those who buy insurance, are actually going to see their taxes reduced as they buy insurance. They'll have health care coverage at an affordable cost. Their taxes will go down. They receive subsidies. The essential point here is it is not a tax increase of overwhelming largest ever on the middle class. In fact, it is a huge tax reduction. And secondarily, there is a decreased cost to every American that buys health insurance today because there will not be a shift of cost from the uninsured to the insured and to the taxpayer. That's precisely what happens when you have some 40 million Americans uninsured. They get sick. Fortunately, in this nation, we have not yet come to the point where we do not provide health care to people that are sick and in need of care. They get it at the emergency room. They get it at the community clinics. It becomes what is known as uncompensated care. In other words, not paid for directly by the individual, but indirectly by every single American that buys a health insurance policy and every company that buys a health insurance policy and the American taxpayers. The Affordable Health Care Act does not increase the cost of health care in America. In fact, it has the significant potential of decreasing the cost, and in the last 2 years we have seen the health care cost in America decline to the lowest inflation rate ever in the last 50 years, except 1 year. Let's get the facts correct, my colleagues. If we're going to talk about tax increases, get the facts correct. Talk about the tax reductions at the same time. Talk about the fact that the Affordable Health Care Act has, while in effect, has actually been part of an overall reduction in the inflation rate of health care. And in the Affordable Health Care Act, there are very significant, long-lasting, powerful reforms that will bend the cost curve of health care, such as electronic medical records. The repeal would wipe that out. Gone. Clinics, primary care clinics across this nation, are funded through the Affordable Health Care Act. And where do you think people get care today? In those clinics. They don't get care there. They're going to the emergency room at 5 or 10 times the cost. There are vaccinations for our children, which incidentally, in the appropriation bill, our Republican friends tried to eliminate many of the vaccinations. Fortunately, it didn't happen. There's preventative care for seniors. so that their blood pressure, so that diabetes is controlled. Today, our Republican colleagues voted to wipe out preventative care, not only for seniors, but beginning this August, a month from now, every woman in America will be able to get preventative screening. Mammograms, pap smears, blood pressure testing. That's what's being lost here, all in the name of some political opportunistic effort to try to run out, once again, what you thought was successful in the last election period. Well, the American public isn't going to be fooled twice. The American public will come to know that in the Affordable Health Care Act, there is real benefit for Americans. Mr. Tonko, thank you for bringing us to this floor. Thank you for bringing us to the opportunity to talk about what is real. I yield back.
Representative Garamendi, I couldn't agree more with the need to exchange statistics here.